When I was doing my dermatology training, I had patients with HS, but it wasn't something that I was necessarily passionate about. Until I finished my training, I went to residency, and I originally was practicing in Charleston in South Carolina. And I had this one particular patient, and she's just so special to me because she was the first patient who made me really feel like I need to be doing something more for this. And in pediatric dermatology, there's like 400 pediatric dermatologists in the country. Like, there's not a lot of us. Yeah. And so we all are pretty close knit. So if I have a difficult eczema patient, for example, I have my experts that I'm going to go to. If I have a difficult psoriasis patient, I have my experts. I felt stuck because I didn't have my pediatric HS expert that I could go to for help. And when I started asking people, so who's the pediatric HS person? They were like, well, there's some people who do acne, so I guess they kind of do HS, but like they were really more interested in acne rather than HS. So that's kind of what got me interested in HS as a whole, was, you know, wanting to take care of this particular patient who was quite severe when she originally came and then progressed very rapidly. And so I learned a lot from caring for her, and it made me want to learn more about how to, you know, take care of kids and then teach other people how to take care of kids with HS.
Okay, no, I like that. So like I had HS at like 12, right? I got diagnosed when I was like 13 because it took a year. But the way that it played out is very interesting, right? I think it's a story for a lot of people who have HS. Is I went to my general doctor because I had a pain, and that's where you go. And it was like, oh, you're getting these things because you're overweight, if you lose the weight, or you're just not showering, you know, well enough. And so like, I kept going back for a year. And so then eventually he was like, I think there's an issue with your blood. We need to like clean your blood. So like I was sent to like a children's hospital, like 2 hours away to like have my blood cleaned, which I, like as a child, I didn't even know what that meant. I'm like, you're gonna drain my blood? Like, I'm like a vampire? Like, what the frick, what are you doing? And so like I went there to have my blood drained at this children's hospital. It was the Ronald McDonald Institute, you know, for children. And when I got there, one of the doctors came out. He's like, there's not an issue with your blood. Like, you have HS. And he just kind of walked away. And literally, that was it. He told me what I was diagnosed with. There was no, like, this is what you need to do. Mm-hmm. This is what it means for you. And, like, I don't know if he expected my general doctor to tell me. I didn't know, like I left out, again, at, like, 13 with my mom. And I'm like, so what do we do now? And my mom's like, I don't know, but we know what it is. Like, we know why you are in pain. And so, like, then it was me doing research for the next 20 years of just figuring it out. And so how can we remedy that with people? Like, one, how do you diagnose people or children with HS, and how can they help their general physicians spot it early on so they can get to where they need to be?
It can be tough, and it makes me sad because that story that you're telling, I still hear, you know, all the time, where they either went a while without knowing what it was, and then when they did have someone who actually knew what it was, that was like, here's your diagnosis, bye. Like, there was no explanation, there was no like, I'm gonna help you get through this, I'm gonna get you to the right place. Like, you know, it just leaves people feeling like very abandoned, and like you have to do all the work because nobody else is helping you with it. So in kids, in order to make that diagnosis, it can be a little bit tough. There, you know, the same areas are affected as are in adults. The same, you know, types of spots come up as in adults. But there's a couple of key differences. And one is, you know, Dr. Hamzavi was talking about those two questions that you can ask to make the diagnosis, which is, in the last 6 months, have you had boils in your skin folds? And if so, how many of them have you had? And in kids, that 6 months might be too short of a time period, because especially when it's first starting out, they might only have 1 or 2 episodes in a year, and it may take a little while for it to kind of gradually build up and happen more often. So sometimes with that first flare, we might not be able to make a slam dunk diagnosis. But there are clues that we can look for to help us figure it out. So what I will always look for, even if it's an area that they say is not involved, like if someone comes in and I'm thinking they could have HS, I look in their underarms, I look on the chest, I look in the groin and the buttock area. And what I'm looking for are signs of little pus bumps that maybe aren't painful yet, and so you don't see them, but you have them, or blackheads, these like just plugged up pores that are there, because you really shouldn't have blackheads outside of like your face, your upper chest, your upper back, or your ears. Like anywhere beyond that is more, I'm more thinking about HS. So if I see those clues, even if it's their first time saying, I've had this, I had this painful swollen bump and it drained or it went down on its own, I'm thinking they most likely have HS, and I'm going to start kind of treating them that way.
So how could one go about, because like not all dermatologists have specialized or doctors, in the realm of HS. So my niece, right, she's 9 years old. She started getting bumps on like her butt. And so like my sister's like, oh, like she just has, acne on her butt. And like they go away, they don't get too big. But then later on, that was at like 7 or 8. And so then she's 9 and she got like a flare that was a bit bigger, like it was like it looked like a boil. And so on her chest, and my sister's like, oh, I don't know, it's a boil. And then it like went away, and then it came back, and it did that 3 times in the course of like less than a year. And I was like, she probably has HS, because that's what I dealt with. So, I'm not a doctor, I can't diagnose her, but I was like, it looks like HS. And so like I started with, okay, so this is what I've been doing for myself, and kind of working with her with it. Then my sister went to the dermatologist, and she's like, oh no, it's not HS, it's just, she just has like it's just a boil. And I was like, it's just a boil, but it's reoccurring, it keeps coming back, like that's not just how boils generally work. And I was like, but I'm not a doctor, so I can't speak on that. If her dermatologist said it's not HS, then I guess it's not. But for me, my sister took that like it's not HS because that's what the dermatologist said. But for me, I've like garnered such a mistrust of doctors, just the medical field as a whole. And so I was like, she probably doesn't know what she's talking about. But again, I'm not a doctor, so I'll just step back.
Right. That's where I think being an advocate for yourself comes in, because the thing is, if they're going to tell you, okay, well, it's just a boil, then it's okay to push and be like, okay, so why don't you think it's HS? Or, so if it's just a boil, why does it keep coming back? Like, push them a little bit. It's okay to do that. Like, I really like when my patients ask me questions about what they're thinking, because I might not know what's on their mind, like why they're either not sure that I'm, have the right diagnosis or not. And usually I will try to explain my thought process, which is like, this is why I don't think it's this, or this is why I do think it's this, because I think that helps. But, the only other thing that should cause recurrent boils in a kid is a MRSA colonization or a MRSA infection. And you should be able to tell that by swabbing the pus that comes out of those spots. If it doesn't grow MRSA, it's not a MRSA infection. And so sometimes I will do that with my kids, where I'm like, I'm not sure, I can't really tell which one it is. I don't see the open comedones. You've had a couple of them, but they're like kind of in skin folds, kind of not. So I will do a swab and send it, and we'll see. And if it grows MRSA, cool, that's what it is. If it grows a mixture of bacteria, that's HS. So I think, and we kind of talked about this earlier today, like, if someone wants to get a second opinion, I especially if I have a patient who I'm like, I don't feel like we're getting where you want to be, I will ask them, I'm like, would you like to get a second opinion? Like, would you like me to give you some names of people who, I trust? Maybe if you don't trust me, that's not a good list, but like, people who I feel like also know HS or know whatever your condition is very well, to go get a second opinion and see what they think. Because it is a win-win for you as a patient to go and get a second opinion. So, for your niece, I would say, if she gets another one, go see a different dermatologist, or go back to that dermatologist and say, why do you think this is not HS? Because to your point, like not every dermatologist even has a correct understanding of HS, because it's not something that we do a very good job of teaching well in residency, and the information is changing. And so if that's not something, if you graduated 20 years ago, you're not keeping up with it, you may still think this is a disease of sweat glands and you can't do anything until it gets bad enough, and then the surgeon cuts it out, which is what some of my patients have been told. But I've had patients been told it can't be HS because you're too young. It can't be HS because you haven't hit puberty. It can't be HS because you're not overweight. It can't be HS because you're not black. It can't be HS because you're not a girl. All of these things have been told to my patients. And so and we know anybody can have it. So I think going to get a second opinion is something that I would do if it happens again, and not feel bad about it for a second.
Yeah, no, definitely. I have to relay that to my sister, because like I'm always like, because my sister's a nurse, right? And so I'm always, in the ongoing joke is like I'm honorary medical professional according to the people who follow me on TikTok, with the things that they ask me. But I'm like, I mean, I know a little bit about this. I've been dealing with it for 20 plus years. I can't talk to other points, but I know a little bit about HS. So no, thank you for that. I would say, so we were also talking about like the Hurley stage 3, when you get the deep tunneling, right? And so like you've done that on some of your kids that are coming younger. I told you, I was like, it looks very scary, and unless I can go under, like put me to sleep, I don't know if I could mentally handle it. But then I was a little ashamed, and you were like, well, little 10-year-olds come in and they do just fine. So I might gotta just.
In your defense, it is about 50-50. I have probably more 60-40. I have slightly more than half of my patients want to be asleep for that procedure. And I'm fortunate as a peds derm because I have the ability to do that. A lot of community dermatologists don't have access to an OR where they can actually put people to sleep and do those procedures. And technically it's not required that you have to be asleep. It's not that major of a surgery. But I think, whoever would be doing the surgery, if there's somebody who does a lot of these, they're generally really good. They've got it down to an art. They're very good at numbing in a way that is not like super traumatizing. And I do recommend like bring some headphones so that you don't, and just like close your eyes and just zone out and listen to music, because you don't have to listen to what's happening. You don't have to look at what's happening. You'll feel touching and like maybe.
Do you feel
touching,
pressure? Like I feel like it's gonna be like when you go to the dentist, and even though they numb it, the pressure is so. I feel the pressure is like so. It's hard to describe. Like it isn't pain, but the pressure is really intense to the point where I'm uncomfortable. So is it like that?
I haven't. Occasionally I've had patients tell me where they're starting to feel something, and I'll give them more numbing medicine, and that takes care of it. We're not really going super deep with these procedures though. We're more just kind of probing around a little bit, so that pressure of like, because with the dentist, they're like drilling into these things. So I think it's probably less of a concern.
Okay.
Yeah, less pressure.
Okay. I'm gonna have to look into it. I guess it goes to the next one. Like, how can we find a right doctor, the right surgeon? Because a lot of it is just kind of baptism by fire. You just got to go to someone and see if it actually works or if they know what they're doing. Is there a website that you guys have that like can tell me like this person specialized, this is a good resource, a person to go to?
Yes. So the HS Foundation, which is hs-foundation.org. If you go to their website, they have a clinic finder and like a physician finder. So you can go on their website, and they've vetted every single person who's listed on their website. So they go by state and they just tell you like, these are the people that you want to see. And the vast majority of those doctors will also see kids, which is nice. But then you know that you're getting somebody who knows what they're doing and is experienced with HS.
Okay, yeah, that's definitely, I think, a pain point, right? Because like when you are going to any doctor, all you have is really a Google review. Like you look up what other people have left, which could be good or bad.
Right.
Like you don't know if they're being honest. They just had a bad day. Like you just don't know how, or they're saying they were bad because of X, Y, and Z, but that's not what you're going in for. So it's just really hard to gauge.
Right. Like they could be a great dermatologist. They just, for eczema or psoriasis or something, they just don't know about HS. So they're not going to be the right person for you. And that is sometimes like, you got to try it for an appointment or two and just see where you're getting with it. If you're looking on that HS Clinic Finder and there's nobody close to you, because it is hard to find somebody who you can feel really confident like knows what's up.
No, makes sense. So I got a question today from someone, and I guess you would know a little bit more about stuff that goes on the skin about adhesive. So they're allergic to adhesive, and so a lot of times with HS, right, we got a bandage, it needs to stick there, it needs to stay in place. What can they use? What would be some good products that would allow it to? Because like I've tried those pads that's supposed to just kind of like stick in place. They don't stick in place. Mm-hmm. And so normally I'm not allergic to adhesive, so I can just put whatever tape on it. But this person that messaged me today was like, I'm allergic to adhesive. What can I use?
Mm-hmm. So part of it is figuring out if you're actually allergic to adhesive or not. There's a lot of people who think they're allergic to adhesive, but they're actually just sensitive to it. Mm. You can 100% have a true adhesive allergy, and you get like, super itchy, like blistering rashes, like where adhesive touches your skin. A lot of times though, we just get irritant contact dermatitis, which is still a rash, but there are things you can do to manage that in terms of moisturizing the skin, prepping it beforehand, trying less sticky tapes. May have some adhesive, but they're not like the super hardcore tape. That can sometimes help if you have irritant contact. But assuming you are truly allergic to adhesive, it's tough because I think it also depends on how much you sweat. Because if you don't sweat a ton, then they do make these foam pads that do have like stickiness to the back of them. They're not just like the ones where it's like, oh, put some Vaseline on it, it'll just stick there. Like the Vaseline slides right off. So there's some foam ones that have some actual sticky stuff on the back of it that you can put over the areas. And sometimes it helps to cut it. Sometimes it helps to just slap it in the, crease. But there are tapes that are made for like kids with blistering skin disorders. So there's one called Mepitac, which is, it's not the stickiest tape in the world, but it's better than nothing. So I do have some patients who like to use that if they have a true adhesive allergy, because there's no actual adhesive on it, but it can kind of sort of stick. But I think that that's something that we need an answer in this space, because it is hard to get things to stay in place when you don't have, like when you can't use adhesive.
Because like that's like the number one formula thing, like silicone though. So like, how does the silicone work? So if it's not the only thing I know about, I don't know much about silicone. So I just know it feels a little rubbery, but like, so how is that sticking?
So silicone can work too. I actually don't know like the biomechanics of how it sticks. And
but
is
there's
nice
no adhesive,
you can kind of like peel it back.
Apply
some medicine or something, and then like put it back. You can peel it back and forth a couple of times before, like a number of times before it doesn't work anymore. There's no adhesive to that, but I have some people, if they're not allergic, but if they have irritant contact, some of them are still a little irritated by silicone. Not as much as adhesive, but they can still get some rashes there. So it partially depends, but silicone's another really good option. And then the HydraWear is a really good option if it's an area where that's kind of designed to help hold a bandage, because you don't need any adhesive for that to hold in place.
Yeah, no, I like that. And that's one of the things I did recommend. I was like, if you can get HydraWear, like try that out. So going back to the point of like the surgery, right? So I kind of doing a little research had determined like as a child having as an adult having HS, I would have skin wounds that would never heal, right? So I think that was probably the hardest part for me. It wasn't even the flare. Like I was walking around with an open wound that it's literally decaying flesh, and so I smelled like rotten flesh. And so I was trying to heal heal the wound faster so it doesn't smell, or to like I mean I felt like I kept it clean, like I had to try to clean it, but like what are some steps of like either with cleaning or just something that can be done to either close it up faster or keep it clean? Like I was always told like, oh, keep it dry, and so like I was always putting on gauze, and I went to the doctor, several times to get, when I would go to get them lanced, and eventually they taught me how to pack my own wounds, so I started packing my wounds and stuff, but like they still just wouldn't heal, and it would have that, I was telling you, like the white skin, I call it the white meat, right around the skin before it got to the pink part. But like that's where the smell was coming from. I know that's the smell, but like I don't know how to heal that faster. Like the skin's just not healing. It'd be months, and I live in Florida, so compounding the heat and sweat with this open wound, which like it's really hard to keep dry, and like I think that's probably the biggest pain point that I've seen from a lot of people, of where the embarrassment comes from, is like, I can hide the scar, I can't hide that smell.
Yeah. So that I think is where that whole concept of like a biofilm comes into place, because there are these like little ecosystems of bacteria that have blocked themselves off, and they're hanging out, they're chilling, but they're not really consuming things. So like you can put someone on antibiotics for like 3 months. The bacteria doesn't take it up fast enough for it to actually work. So nothing happens when you put them on it. And there's research being done into particular products that can be used to kind of break up biofilms. And I think Manuka honey might actually have some data to suggest it's one of the things that might help with that. I've actually seen some people use breast milk. I don't know if that works for everybody, but it's worked for some of my other patients with wounds that needed to be like debrided. So a lot of times though, when I have patients where they're like, this is the spot and it's just open and it's just not healing, to me, that's an indication that there is like that biofilm and that sinus tract, that jelly stuff that's like down underneath. And that's when I want to do, it's hard to tell if you're like medically under control, and you're just having like your sinus tracts flaring or your scars flaring, or if you're not totally medically under control, you're having too much inflammation. So I try to get people to keep track of, when you get your flares, are they new spots? Like, are they in new places, or are they just these same exact spots that are opening and closing, or just staying open? If they're the exact same spots and you're not getting new spots elsewhere, that is when I think that procedures can be really, really helpful, to actually just go in, clean it out, and let it heal in with healthy scar tissue. Because these are generally skin fold areas, you can start with a scar that's like with an open area like this big, and it'll shrink down to a spot like that big. It's wild to me how well they heal, and then they're not painful anymore. So when I have that, where it's like it's just this wound that will not heal, a lot of times I do think about doing procedures or doing like an injection of medicine or something to try to get physically into that spot to try to fix the problem.
Okay, that makes sense. With that, so like growing up, like I said, I went like 10, or when I was like 12, 13, right? I went to the doctor a lot to get them lanced. Do you think lancing causes the scarring? So like, I mean, obviously it's going to cause some scarring, but do you think that's a reason why the tunneling is so bad, is because of them being lanced?
I do. I think I really try to avoid lancing them unless they are huge, and I can tell there's a ton of pus in there, and it's not going to come out on its own, or if it does, it's going to be catastrophic, and we need to help it come out. But it has to be pretty bad for me to say, like, yeah, I think we need to cut into it and drain it, because I do think that's what happens. We know that's what happens, that if you get an HS spot cut into, the chances that that same spot is going to come back again is upwards of 80% chance that that spot will come back again. And it's because if you're thinking about it like an infection, we want to cut into that boil so that the infection can come out, the body can finish the healing process, and then it can heal up. But there is no infection to come out. It's your body that's confused in the first place. So you open it up and your body's still like, I can't fix it. So it just fills in that area that you had cut open, rather than letting it air out and heal up. It just fills in that spot and forms that tunnel to the surface. So I do think that, if people have had these cut into and drained before, those are often the spots that I'm then going and doing procedures on months to years later, because they just keep recurring.
Yeah, because like mine, so I have, flares under both arms, under both boobs, the growing, right? And so, however, the ones under the arm is where I got them lanced. The other ones I've never gotten lanced is where I have the Hurley stage 3. It's where they will come back more often with flare, like that will flare up. And so I guess, how do you remedy that? Like as you have a child, the only thing that's going to give them relief, you go to the ER because they're in pain, and you see it, like, oh, let me take you to the ER, or the what's the thing called?
Urgent care.
Urgent care, yeah. That's the word. You take them to the urgent care, they're gonna cut into it. Like that's just kind of the only option. And I feel for my mom and other parents, right? Of like, I don't want them to be in pain. I'm gonna take them there. This is the only remedy that they have is let's drain it.
Yeah.
Let's relieve the pressure. So like, I don't know if there's something that can be done at home, or if there's like better education, like what can they do in those sense to help their kids with, because at this day and age it's really hard to get into to see a dermatologist or a doctor. Sometimes it can be months out, and that's, it's not an option if you're dealing with a child that's in pain.
Yeah. So we have like a 3-month wait to come see us. It's realistically longer, because that's how long our schedules are open, and so people call all the time and are told there's no appointments. So, however, that's for the average person off the street. It takes 3 months to get in. If your doctor can advocate for you for a specialist and say, hey, this person can't wait 3 months. They really need to get in to see it. Now, this is not a flare solution, but if you're like, if you're someone who's flaring frequently, you need to see a derm, asking your primary care doctor to advocate on your behalf to that specialist is reasonable. The worst thing they say is, no, we can't, move the appointment up. But a lot of times, even if it's just by several weeks, that's several weeks of treatment that you're getting that you weren't going to get before. Once my patients are established with me, I try to do everything that I can to keep them from going to the emergency room, unless they absolutely have to. So I want them, and it's hard because I'm in a big hospital setting. I'm in a major academic center. You can't reach my nurse, like you can't reach our office to save your life. It's so difficult. It's so difficult. So I try to get all of my patients to sign up for what we call the patient portal, which is like the electronic way of communicating with us. Because if they send me a message, they're like, hey, I'm flaring. One of my nurses will see that within 24 hours, and we have a protocol that we will then sort of kick off at, hey, where can we fit this patient in, either today, tomorrow, at the latest the next day, so that they can come in and we can look at it. If we need to do a short course of anti-inflammatory antibiotics, we can do that. If we need to inject some steroid medicine directly into the nodule, because that can be helpful, we'll do that. And then rarely they come in and I'm like, yeah, we need to cut into that one, and then we'll do it. But you have to find a place that sees enough HS patients, that has a method in place for you to be able to request an urgent appointment and be seen in a day or two. And not everybody has access to that.
Yeah. can we clone you? Like, is that like is that a science? We're moving really forward with science, so I feel like if we could clone you, we can get some things done.
If we could clone me, I could get some things done. So I feel like I would not be opposed to this. Ethical issues aside.
Okay, so you mentioned the steroids. Like, I hear steroids and I think illegal. I think banned in sports. Right. I think. Yeah. Should this be in my body? So like, what are like, I feel like as a parent, I'd be like, you want to inject them with like, what's the downfall to that?
Yeah. So the way I explain it to people is, I'm like, this is an anti-inflammatory medicine. And sometimes if I see their face when I say we're gonna use some steroids, and they're like, it's not like the GER kind of steroids. Yeah. So, you know, there are different types of steroids, and steroids are actually extremely natural. Our body makes steroid hormones. So cortisol is a steroid. Okay. That's the stress hormone. That's like, you know, what can lower our immune system a little bit, and is what helps us get sick when we get stressed out. That's cortisol. So it is anti-inflammatory in the short term when we use it the way that we do. So I will offer it to people, and I'll say, this is not a immediate, like, you're going to walk out of here an hour later and this is going to be fixed for you, but over the next day or two, the goal is that I've put this medicine just directly into the nodule, and it's going to calm down and get better for you. When we do injections of steroids, there's a much lower rate of actually absorbing it into the rest of the body and having the side effects of steroids. So what are the side effects of steroids? When you take high doses for long periods of time, it can make you really hungry, it can make you really irritable. We don't like people on them for long periods of time because it can affect your bone health. You can get cataracts, like there's crazy stuff. So. Yeah. What's tough is that prednisone works really well. So I have some people who I'll give it to them for a really severe flare, and they're like, this is the best thing you've ever given
keep giving to me.
Just keep giving me this. And I'm like, I can't do that. So it's like, we have to be very careful about it because it works well, but the side effects of long-term use are not worth it. But it is safe to use in the short term, and it can be really helpful if you're using it at the appropriate time. But I also have some kids who want to come in every week for an injection, and I have to tell them, I'm like, we can't do injections that often, because while you're not absorbing a lot of it, you are absorbing a little bit. And so I don't want to do them that close together where you're going to start building some up in your system.
So what would be your other option? So, because I would get them frequently, or they would come up in other areas, right? So you just use a steroid for this area, you don't want to use it again, 2 days later because they got it somewhere else.
Yeah.
Like, what would be your other remedy for that?
So I'll try antibiotics in those situations. And again, part of my job is figuring out, like, trying to fix the fact that you're getting all of these so frequently. So like, any part of a flare plan has to be working on a maintenance plan. We have to have you on some kind of more long-term fix to try to help manage this, whether that's a biologic, a hormonal medicine, and insulin resistance medicine, zinc supplementation, laser hair removal, something. We have to be doing something to try to keep as many of these from coming up. But I will put people on antibiotics when they're just getting, multiple flares in a month or in a week, just to calm things down. So it's also a short-term solution, but it's a longer-term, short-term solution than the steroids are. So I can use those, for up to 3 to 6 months is usually, we don't want to go beyond that because we do start to run into issues with antibiotic resistance, gut flora issues. So 3 to 6 months is usually our cutoff of, I don't want to use antibiotics for longer than that without taking a break from it, which is sometimes enough to get some of these other medications on board and actually working, because all the rest of them, they don't work that quickly. They're not good flare treatments. And I have some kids who were only started on a biologic when they came in and they were horrible, and they were like, okay, we have to get you Humira, and that's the only thing they did. And I'm like, but that's not gonna help you. Like, assume it's gonna take you 2 weeks to get the Humira in the first place, and then when you get it, it's gonna take a while for it to start working. So like, that's not gonna help you in this acute, I'm having pain right now, what do I do? Warm compresses can be helpful for some people. It can kind of help bring it to a head. And if it's not open and draining, sometimes like a topical lidocaine, like an over-the-counter topical lidocaine can be helpful. It can kind of take the edge off. So there's other little things that you can do here and there, but I do think that's an issue, and I think somebody was mentioning this, where I need more things to be able to offer people when you're having a flare. Like in the moment, what can I do to help you? Because right now we're really limited.
Yeah. No, I feel that. As someone who gets
sure
flares, I feel
acutely.
that. So with the topical creams, do you feel like those work as well as the injections that you were just like, because Humira is like an injection, the steroids, and a couple of the other, like, they're things that you like ingest.
Right.
Versus like these creams.
Systemically versus locally.
Yeah. Do you think they are as equal?
I think it depends on the type of HS you have, to be honest.
Ooh, I'm glad we gotta talk about this whole different types of HS, but yes.
So in my experience, some patients who are mild enough and localized enough, that's all they need are topical things, and they work really well. I have some patients who need systemic control because they're flaring in so many different areas. But for bad flares, topicals can still be helpful in certain situations for those patients. And I have some patients, topicals don't do anything. They do nothing.
Yeah.
So I have not yet figured out a good way to figure out who's going to fit into what bucket. So I try topicals for everybody. I'm not going to only try topicals for somebody who's like pretty severe, which I think is unfortunately something some people still do, especially for kids. A kid comes in, they're like, you are a child. I don't want to throw too much medicine at you. And I'm like, bro, you should. Like, it's really bad. Like, please don't. I give a talk to dermatologists, and I have a little meme that I made where there's like this window on a building there's just flames shooting up out of it. The building is on fire. And there is a guy next to it who's just like, with a little like bucket of water, tiny bucket of water. And I labeled it like severe hidradenitis suppurativa topical clindamycin. And I'm like, don't be this guy. Like, please don't be this guy where you're just putting someone on a topical medicine for something that clearly needs more than that. So I don't know if that answers your question, but I think it can be helpful in the right patient.
I generally use a lot of topical creams just because I'm always like, ugh, like even Tylenol, I'm like, what is that going to do to my body? And so, I mean, I'm sure topical creams, they get ingested through the skin. It's my biggest organ. So it's all doing something to me, but I feel a little bit more with those creams. But Neosporin, so I don't know if you've ever used this, or I don't know what it is in the Neosporin, but like you put Neosporin on a flare and it like helps relieve the pain, or it helps it drain. I don't know if you've seen that or heard that before.
So it depends on the Neosporin that you're using. And I'm glad you brought this up, because in general, dermatologists hate Neosporin. We hate it. And it's not because there's anything wrong with it per se, but it is, if you put it on open skin repeatedly, you become more likely to acquire an allergy to the actual antibiotic in it, either the neomycin or the polysporin or polymyxin or whatever it is. You can acquire an allergy to it. And that makes it very difficult for wounds to heal then if you're putting something on an open wound that you're allergic to. So Neosporin by itself, plain Neosporin, is a good antibacterial, it's a good antibiotic ointment, but it doesn't necessarily help with pain. However, there is a Neosporin that has pramoxine in it as an active ingredient that's kind of added. That's where the pain relief comes from, is the pramoxine. Okay. There are over-the-counter anti-itch creams that contain pramoxine, because it's not just anti-pain, it's anti-itch. So you could probably get the same benefit from just using pramoxine by itself and not have that same risk of acquiring an allergy by using the Neosporin with the pramoxine in it.
You can just go buy you could just go buy it.
Yeah, it's just over the counter. Okay. It's usually an added ingredient to something else. It's not like you can go buy pramoxine cream. But if you Google like Pramoxine anti-itch creams or Pramoxine creams, like stuff will come up.
Okay, I'll have to check that out. So I do like a lot of holistic type stuff. And so I'm probably like a doctor's worst nightmare. I'm like, let me Google this. I'm going to get in the kitchen like a bruja and mix something up. So I got a couple concoctions and they work for me, right? And so I posted it on my social media, and I've had like hundreds of people like they've done it and they're like, this is great, this works for me. And so from a medical standpoint, though, not the Neosporin, potatoes, raw potatoes with inflammation. I'd put it on where I have an abscess, or even if I have like pink eye or something, and it pulls the toxin, it pulls something out. And so like in like a day, like the pink eye is gone, or the flare is not as inflamed, it doesn't hurt as much, and then within like 2 days it's drained. And so I've seen, like I've done that. That's literally been my choice for the past 20 years. I've tried other things just to try them out to see if they work better. Yeah, but my go-to, if I have something stubborn or if I'm in like real pain, there's nothing I'm grabbing first other than I'm going to the fridge, I'm grabbing a potato, cutting potato open, and let's go.
These are the things that are interesting to me, though, because like obviously that's real. That's worked for you for 20 years. To me, then my question as a physician is why? Yeah. What is it in the potato that's doing that? That's what I want to study, where I'm like, can I figure out why that works, and can I turn that into something that I could make a medication that then insurance would cover and people could get this and we could like give it to people? Because I don't know, like let's say it's a chemical in the potato. Every potato probably doesn't have the exact same amount of that particular chemical. And would it work better if there was more of it? You know, would it work better if we added something to it? Who knows? So to me, I think that starting with those kinds of things is where, you know, someone mentioned it earlier, where we get these ideas of like then doing the research to find and identify these compounds that we can then, you know, remove anything extraneous and use it. But also at the end of the day, it's a potato. That's
not
great.
that hard, yeah.
Like just grab the potato. So if my patients come to me and they're like, what do you think about doing this? What do you think about doing that? Yeah. So if I had a patient come to me and they're like, I saw this girl on TikTok and she uses this potato, and like, what do you think about me using a potato? I'm going to tell you to go for it, because I may not be aware of any evidence that it helps, but I'm also trying to make sure, like, what's the worst thing that could happen to you if you use this potato? Nothing. Nothing bad is going to happen to you if you put a potato under your arm. When we start talking about other things, then it gets a little bit more dicey, where I'm like the Neosporin, where I'm like, you can use Neosporin, you are welcome to try it, but just be aware that there's this risk of acquiring an allergy to it. So if you do feel like it's not helping to heal it, or it's becoming more itchy after a couple days of applying it, then you may have acquired that allergy. But I think it's important to help patients. For me, it's important for me to help them figure out, like, is it safe to try this thing? And do you have anything to lose from trying this thing? Or have I heard stuff about it and be like, yeah, actually, there's some evidence behind that. Definitely, I think you should go for it. I feel like the tough part about HS is there's so many things that have worked for different people, that most things a patient brings to me, they're like, hey, so I tried this and it really worked. And I'm like, oh yeah, like I've heard of that. And so I had one patient be like, then why didn't you suggest it to me? And I was like, because I can't suggest all 100 things to people, like, all at the same time.
Vomit of like,
just like, here's a list. Like, I've got a 2-3 page booklet of like all the different things you could try, because there's just so many of them. Yeah. And it is so individual, like what works for one person versus another. And I think until we get better at figuring out how to predict who's going to do well with what, it just is like trying stuff and continuing to discuss new things to try, which is actually why I kind of, you know, the internet's a double-edged sword, but I kind of love this about TikTok, that HS is now becoming a thing where people are finding other people with HS and can diagnose themselves with it. Like, my TikTok gets slammed with videos of like those like at home laser hair removal devices because I was searching for one and now it's like all it'll show me. But I always go to the comment section and there's never one where at some point someone doesn't start talking about their HS and that they got this for their laser hair removal for their HS, and then people start having a conversation in the comments. So I actually think that having TikTok and having that be a place where people can go and learn about other things that maybe we didn't have time to talk about in my 15-minute visit with you. Mm-hmm. I love that. I think that that's great. And I hope that that means that people find better treatments that work for them because they're learning from other people who've had success with it.
That's the thing. So I was diagnosed with 12, 13 years old with HS. I didn't meet someone else with the condition until I was 28. And it was through a video on TikTok. And I was like, because I was still under the assumption of like, this is very rare, and no one has this but me, and you don't talk about it. And then I'm like, I saw a video, and then and then of course, you know, the algorithm. So then I started seeing more, and I'm like, all these people have HS. And then it was like, whoosh, because I was still at that point in my life where I was very much like, I'm not wearing anything that shows my arms. Yeah. I don't tell like my friends who've known me for years, like we didn't know you had this. My sister's like, not until I posted a video on TikTok where I'm probably the most vulnerable when I talk about my HS because the community is just so good there. She's like, I never knew you got flares under your breast until I saw your TikTok. And I was like, again, like family, I just don't talk about it with them because that's just how it's always been my entire life until I was on TikTok and I saw other people who told me it's okay, you're not alone. And then I'm like, let me make content so other people don't feel alone. And then it became this like sharing of like you said, of like, this is what's worked for me. This is what I've done. So I, grew up doing the potatoes in the bleach baths, right? I'm from the South. So grandma's like, bleach bath, you got a ringworm, you got whatever, go take a bleach bath and you'll be okay. And so, and those things have worked for me. And I know we were talking about it in there. Some people, dermatologists have prescribed, bleach baths for HS, for eczema. And I'm converted. Like I've been converted for a while to it. Like for your point of view, I guess, would you say yay or nay to the bleach baths, especially since talking about it with children? Again, my grandma, get in the bath, but like in general.
I use a lot of bleach baths. Yeah. I mean, for eczema, not as much for HS, but mostly because most of my patients at this point are teenagers. They're not taking baths anymore. Mm-hmm. And so it's a little bit of a pain in the butt to like fill up the bathtub, pour the quarter cup of bleach in, mix it up. So sometimes like that is where I think the products like Clean or Vosh, mm-hmm. like they're basically a bleach bath in a bottle. Now they're expensive. They're more expensive than just making a bleach bath in your tub. So you can also make just like a bleach bath solution in like get a gallon of water and you put like a teaspoon of bleach in it and you mix that up. And so it's like a mini bleach bath. You can put that in a spray bottle and just kind of like spray it in those areas. So I will have people do that sometimes, but a lot of the whole antimicrobial wash thing with me is just trying different things with people until we find one that seems to work. And I don't often get to the bleach bath one that often, but maybe I should be doing it more often.
Yeah, I for me, like I think it helps with calming. Again, like the pain of it, right? It soothes it. Mm-hmm. So like either a bleach bath or getting in the pool. I don't own a pool, but if I'm at somebody's house who has a pool, I'll just hop in a pool. But it's the same thing, right? So it's the chlorine, and using that, and I think I like the Clean and those other washes, but on my channel I try to find holistic things, but also things that aren't going to break the bank. Mm-hmm. And that's another thing that I worry about, because a lot of these products can start adding up.
Yeah,
and if insurance doesn't cover, they're going out of their pocket to buy these things. So I'm like, what can I give you as a solution that will give you the same effect without breaking the bank?
Yeah. And I think, it's interesting because, I have HS patients who are like, oh my gosh, going in the pool is the best thing for my HS. And so I swim like multiple times a week. And I have some HS patients who have had to stop swimming because it's the thing that aggravates their HS. No matter what kind of swimsuit they wear, no matter what they're doing, they get a flare after they've been in the pool. And I don't know how to explain that.
Again, it goes back to our previous conversation of like HS looks different on everyone, and like the triggers are different for everyone, which then makes it really hard because we all want to find something that works. And so like you see something that works for someone and you want to do that, and then it becomes very discouraging when it doesn't work for you and you don't know why, that like everyone's finding relief but me. And so like I think it would take research to like more research than like we have time to like dive into, but of like trying to understand the difference of like how mine is. I strongly believe it's insulin resistance, like driven. And so once I got my insulin under control, like I was saying earlier, my flare-ups pretty much went away. They come every maybe 6 or 7 months. I might get a small flare, but I'm not in pain with it. They don't smell anymore. Like it's a lot more managed. And so is my diabetes, which is a whole nother thing. I don't know, I'll circle back around to, but it's a lot better managed with that. But then there's also another HS warrior that I know, right? And so insulin, sugar, she eats what she wants. Like that does not bother her. But then she'll eat like a potato and she's like flaring, and I'm like, I eat this all day. And so like it's hard as someone who has it and creates content, and I'm like, this is what I'm doing. And then people in the comments, like, because I feel for them of like, that doesn't work for me. Like, and then I'm like, well, I don't know. Yeah. I mean, there's no question in that. It's just like, it's
But it's hard
peculiar.
Because I do feel like it is more, I see that more with HS than a lot of the other conditions that I take care of, where it's like, well, what works for one person may do nothing for another person. That happens a lot with HS, and it doesn't happen as much in other skin conditions. I'm like, this is a medicine, and I am 90% sure that it's going to work for you. And I do not have that confidence in HS when I put somebody on any given treatment.
Well, is that more because like we don't know what the cause of it? Like I feel like well, I don't know much about eczema, but like, is there like a root cause to it that causes this or any like these other conditions versus HS? Like we don't know if it's hormonal or genetics or if it's, environmental. And so like it's harder. And if it's all of those things, then mine being environmental or this person's being this, our treatment isn't going to look the same. But there's no like scratch test that you can do to determine. And so.
Yeah. I mean, eczema is probably a bad example because there actually are different types of eczema.
Okay, I don't know.
It can be a little tough too. But even though there's different types of eczema, in general,
it works.
I still have a general treatment plan that I can be more confident in on average than my general treatment plan for HS on average, because it depends so much on what the driving factors are for that individual person. Because like, I don't think it's one or the other. It's a combo, I think, for a lot of people. Occasionally I'll find people where it's just one thing and we fix that one thing and like everything's great. But I think it's a combo of different things a lot of the time.
No, that makes sense. So
and if you guys have any questions,
please
feel free to.
We're like over
We're
here
just having our own chat.
But going back to like the diabetes, right? So I was diagnosed with HS first at like 13. And then I got diagnosed with diabetes at like 28. And so it wasn't until like 30 that I was like, oh, there's a connection. There's like, the inflammation. And so then I got to thinking like, and reading like if the inflammation had been better controlled with my HS when I was younger, that the diabetes might not have been an issue. Mm-hmm. And so is there ways for people, because like they're both bad things, but like one's like a lot more life-threatening than the other, and like thinking that I can develop this because this is being unmanaged. Like how can I test that if my body has too much inflammation, or like how can I, like some people, I mean you can tell if you're getting a flare up, but sometimes you might not even flare and your body has a ton of inflammation. So how can I either test that or manage it so that I'm not getting other illnesses down the road due to this inflammation in my body.
Yeah, there are blood tests that can be done that look at, there's two in particular. There's the CRP, which is very reactive. It's very short acting. It shows you like at this moment, are you like super inflamed or not super inflamed? And then there's one called the ESR, which is more, it's more of a longer term measure of inflammation. And I think of it almost as more like sometimes the deeper inflammation. So like you could be pretty well controlled and not having any flares, but if you still have a large like sinus tract burden and you still have those biofilms in there, I still find people with elevated ESRs. And so there's not good data on that at all about like how to track that. When do we start worrying that it's gonna, cross over into long-term inflammation and create another inflammatory autoimmune, disorder? But we've actually known this about psoriasis for a very long time, that psoriasis does the same thing that HS does, where it causes this inflammation. It's not limited to the skin. It causes whole body-wide inflammation and increases your risk for things like heart disease, diabetes, high cholesterol, completely separate from any other risk factors for those conditions. And HS is the same. And we don't have a good way of being able to like keep an eye on it, I guess. And there's no guidelines on when you worry about a certain CRP or ESR and when you don't, and how often should you check them and things like that. But in general, that's kind of how you could know, is by checking those levels and kind of seeing, are they elevated? And generally speaking, that means that something else would need to be done to kind of get that inflammation under control.
But those aren't just general labs, because like normally you go to the doctor, they run a set of labs for you. They're very general. Those aren't something that they would just even be checking for on a normal.
Not usually. There are some doctors now who will check a CRP as part of their stuff, but there's not a recommendation for it right now. So it's not
more
something
you have to
where
ask
it's like
for
if
yourself.
right, exactly. It's not if you got like blood work done with your doctor. They probably didn't draw those labs.
Okay, that makes sense. So you brought up a point of like, if you still have like, I'm going to use the word jelly because that's my verbiage. Like if you still have the jelly from when you had the tunnels or and it's still there, it remains there, you don't get it removed, that could cause, inflammation that stays in the body that could also be triggering these other illnesses. So like I didn't flare up for many years, but I've had, I've never gotten these removed.
Yeah.
So it still drains, but it doesn't cause me anything. But that could also be causing inflammation that could cause other things down the road, not getting it removed.
Yeah. I hate to share this, but it's a reason to think about surgery.
Circle back around to it.
Coming back to it.